Welcome again to the Medical Terminology Podcast. This episode is Chapter 15, Part 1, Assessment Techniques and Laboratory Procedures. Well, alright, here we are to the final chapter, 15. We're going to do this in 3 episodes. This first one will be about assessment techniques and lab procedures. Part 1, the assessment techniques. First of all, what is assessment? Assessment, A-S-S-E-S-S-M-E-N-T, is the evaluation or appraisal of a condition. And there's various techniques that can be used. The first one is palpation, P-A-L-P-A-T-I-O-N. Palpation refers to the use of the hands to identify the size, shape, consistency, or location of a body structure. We've all been to the doctor when we get poked and prodded. That's palpation. The next term is percussion, P-E-R-C-U-S-S-I-O-N. Percussion involves tapping on a body part. We've probably all been to the doctor and the doctor taps or thumps on our chest or on our back. That gives them some notion as to what's going on in the chest. Then we have auscultation, A-U-S-C-U-L-T-A-T-I-O-N, auscultation. That's the medical term for listening through a stethoscope. And when a physician is listening through the stethoscope, there's various sounds that can be heard, and we've got quite a few terms here for the sounds. The first one is rale, R-A-L-E. A rale is an abnormal crackling sound heard when inhaling. The next term is rhonchus, R-H-O-N-C-U-S. A rhonchus is an abnormal, low-pitched, wheezing or snoring sound during inspiration, and it's usually due to a blocked bronchial tube. And the textbook gives us a little mnemonic. Rhonchus rhymes with bronchus, so if you've got a blocked bronchus, something going on there, the physician's going to hear a rhonchus. Again, that is a low-pitched wheezing or snoring. Or the physician could hear a stridor, S-T-R-I-D-O-R. A stridor is an abnormal, high-pitched, harsh sound during inspiration. And the textbook points out that a stridor is caused by a blocked larynx, pharynx, or trachea. Next we have a bruit, B-R-U-I-T. A bruit is an abnormal artery sound. Next we have murmur, M-U-R-M-U-R. A murmur is a sound that's made by an abnormal heart valve. We've probably all heard of a heart murmur. A heart murmur is caused by a heart valve that's not opening or closing properly. And finally, we have bowel sounds, B-O-W-E-L sounds, or also known as abdominal sounds. Now, bowel sounds are normal sounds that are heard in the abdomen, but changes in the bowel sounds, either an increase in bowel sounds or a lack of bowel sounds, can indicate a condition. The textbook points out that if there's an absence of bowel sounds, a condition known as ileus could be happening, I-L-E-U-S, and that's a condition of the absence of normal peristalsis. Things just aren't moving properly through the bowels. Okay, well, let's review just over these terms. What is the medical term for listening through a stethoscope? That's auscultation, A-U-S-C-U-L-T-A-T-I-O-N. What is the medical term for the use of the hands to identify the size, shape, consistency, or location of a body structure? That's palpation. Palpation. What is the term for the evaluation or appraisal of a condition? Well, that's assessment. ASSESSMENT. Now let's review the sounds. What is the term for an abnormal crackling sound while inhaling? That's the rale, R-A-L-E. What is the term for an abnormal artery sound? That's the bruit, B-R-U-I-T. What is the term for the sound that would be made by an abnormal heart valve? That's the murmur, M-U-R-M-U-R. What is the term for an abnormal, low-pitched, wheezing or snoring sound heard during inspiration? That's the rhonchus, R-H-O-N-C-U-S. What is the term for an abnormal high-pitched or harsh sound during inspiration? That's the stridor, S-T-R-I-D-O-R. And what is the term for the sounds that are normally heard in the abdomen that are caused by peristalsis? Those are the bowel sounds, B-O-W-E-L sounds. Okay, and then the textbook goes on and talks about instruments for examination, and a lot of these you should already know. They're pretty common knowledge, and we've also covered them back in the individual chapters on the individual body systems. However, there are a couple here that do get a little confusing. First of all, we have a very general term, and that is endoscope, E-N-D-O-S-C-O-P-E. Now, an endoscope is a flexible tube with a lens on the end and a light, and it's used for visual examination. Remember, the suffix scope, -SCOPE, is an instrument for visual examination. Remember that scopy or scopy, -SCOPY, refers to the process of visual examination. Now, endoscope is the very general term for any flexible tube with a lens and light, a scope. Now, there are specific kinds of scopes, and the specific kinds of scopes are named for the body parts that they examine. For example, if we are going to have a scope to examine the abdomen, that is a laparoscope, L-A-P-A-R-O-S-C-O-P-E. We could also have a scope to examine the uterus. We talked about that back in chapter 14. What would be the name of the scope that would be used to examine the uterus? That would be a hysteroscope, Hysteroscope. We've seen a scope that is used to examine the bladder back in the urinary chapter, chapter 9. What would be the term for a scope used to examine the bladder? That's the cystoscope, Cystoscope. So there's a wide variety of scopes, again, They use the suffix scope with a combining form for the body part attached in front, and we've seen many of these already. Now we also have a term, speculum, S-P-E-C-U-L-U-M, and that is an instrument that's used to expand a canal or a body cavity. And then we've got a term that's really hard to pronounce and really hard to spell, and that is the term for the instrument that's used to measure blood pressure, and that is a sphygmomanometer. S-P-H-Y-G-M-O-M-A-N-O-M-E-T-E-R. Sphygmomanometer. And it helps if you parse it into pieces to spell it. The sphig is S-P-H-Y-G, mo, M-O, ma, M-A, nom, N-O-M, and then E-T-E-R. Sphygmomanometer. That's the instrument that's used to measure blood pressure. Okay, now we're going to go back and do a comprehensive practice review of all of these terms. Which assessment technique involves tapping on the body? Percussion, P-E-R-C-U-S-S-I-O-N. Which instrument is used to expand a canal or a body cavity? That's the speculum, S-P-E-C-U-L-U-M. What is the term for the appraisal of a condition? That's assessment, A-S-S-E-S-S-M-E-N-T. What is the term for listening through a stethoscope? That's auscultation, A-U-S-C-U-L-T-A-T-I-O-N. What is the general term for a flexible tube with a light and a lens on the end that's used to visually examine some interior part of the body? That's an endoscope, E-N-D-O-S-C-O-P-E. The instrument that's used to measure blood pressure is known as A or N what? Are you ready for it? It's a sphygmomanometer. S-P-H-Y-G-M-O-M-A-N-O-M-E-T-E-R. Sphygmomanometer. An abnormal crackling sound heard on auscultation of the lungs is known as what? That crackling sound is a rale, R-A-L-E. A murmur is indicative of what type of disorder? Well, that would be a problem with a heart valve. Murmur, M-U-R-M-U-R. What is a bruit? B-R-U-I-T. That's an abnormal arterial sound. What examination technique involves using the hands to identify the size, shape, consistency, or location of a body structure? That's palpation, P-A-L-P-A-T-I-O-N. What is the term for an abnormal low-pitched wheezing or snoring sound during inspiration? That's the rhonchus, rhonchus. And finally, what type of instrument would be used to internally examine the abdomen? That's the laparoscope, LAPAROSCOPE. Okay, part 2, we've got laboratory tests. First, we're going to look at the blood tests. And we have a term for a specialist in obtaining blood samples, and this is a phlebotomist, PHLEBOTOMIST, phlebotomist. And a phlebotomist is a specialist in venipuncture. Venipuncture is VENIPUNCTURE. Venipuncture involves inserting a needle into the vein, literally puncturing the vein, so that a sample of blood can be obtained. And if we've had blood work done at the doctor's office, we've had to endure venipuncture, getting stuck in the arm with the needle and having tubes of blood drawn out so it can be tested. Now, there's a variety of blood tests that are covered in the chapter, and I'm going to review these with you. They can be a little bit confusing at times. The first blood test is a complete blood count, which is often abbreviated CBC, complete blood count. And this is what it sounds like. They're counting the red cells, the white cells, and the platelets in the blood. They do a red count, a white count, and a platelet count. And if there's too few or too many of any of these blood cells, that can indicate a condition. The next term is hematocrit, HEMATOCRIT. Hematocrit is a measurement of the percent by volume of red blood cells within the blood plasma. If we have a lower than normal volume of red blood cells, that could indicate anemia. If the value is higher than normal, that could indicate polycythemia. And if you remember from the chapter on cardiovascular system, polycythemia would be an excessive amount of red blood cells. So hematocrit is the volume of red cells. Then we have erythrocyte sedimentation rate. Erythrocyte, ERYTHROCYTE, sedimentation, SEDIMENTATION, and rate. Erythrocyte sedimentation rate is the speed at which red blood cells separate from the plasma and settle on the bottom of a container. Now, if you think about that, erythrocyte is a red blood cell, right? We know that. Sedimentation refers to the separation of things into layers. You might have heard of sedimentary rock. It's rock that appears in strata in layers. If we're talking about erythrocyte sedimentation, we're talking about the separating out into layers in a container so that the erythrocytes are settling out of the blood plasma and they're settling on the bottom of the container. Now, what does this mean? Well, if one has an elevated sedimentation rate, the rate is faster than normal, that can indicate that there's inflammation going on in the body. Then we have the C-reactive protein test, capital C hyphen REACTIVE, and then protein. This is a test for a protein that is produced by the liver during acute inflammation. If the liver is having this protein kick out, the body's undergoing an acute inflammation, and this can be an indicator of a heart attack or that a heart attack has happened in the body. It can also indicate coronary artery disease. So we've got the two tests for inflammation. that have to be kept straight. Erythrocyte sedimentation rate is the red blood cells settling out of the plasma in the bottom of a container. C-reactive protein, a protein produced by the liver. And the C-reactive protein in particular can indicate heart attack or coronary artery disease, some kind of really acute inflammatory condition. Okay, then we have another term related to the liver, and this is serum bilirubin. SERUM BILIRUBIN. Bilirubin, if you remember from back in the previous chapter, is produced by the liver. And the amount of bilirubin can be an indicator of the function of the liver. If there's too much, there could be liver disease. So this is a test for liver disease. Okay, so if we back up a little bit, we've got erythrocyte sedimentation rate, a test of how the red cells separate apart from the plasma. That's a test for inflammation. C-reactive protein is another test for inflammation. C-reactive protein is produced by the liver. Then we have serum bilirubin. Bilirubin also produced by the liver, but this is a test for liver disease. Okay, the next one is blood urea nitrogen. BLOODUREA is urea and nitrogen. This is a test of the urea levels in the blood. And if the urea levels are too high, it means the kidneys aren't working too well. They're not filtering the blood properly. So this is a test for kidney disease. Okay, let's just review this much. What is the term for a specialist in venipuncture? That's the phlebotomist, PHLEBOTOMIST. What is the term for the test of the percent by volume of red blood cells? It could be a test for anemia or polycythemia. That's hematocrit, HEMATOCRIT. And what is the term for the procedure in which we calculate how many formed elements are in the blood? Remember, the formed elements will be the red cells, the white cells, the platelets. Well, that's literally a complete blood count, abbreviated CBC, and it includes a red count, a white count, and a platelet count. What is the term for a test for liver disease? Okay, the test for liver disease is the test of serum bilirubin. SERUM BILIRUBIN. What is the term for the test of the level of urea in the blood that can be an indicator of kidney disease? Well, that's the blood urea nitrogen, abbreviated BUN. What is the term for the test for the speed at which red blood cells separate from plasma and settle on the bottom of a container? That's the erythrocyte sedimentation rate, ERYTHROCYTE. Sedimentation is SEDIMENTATION, then rate. What is the test for a protein produced by the liver during acute inflammation that could be an indicator of heart attack or coronary artery disease? That's the C-reactive protein, capital C hyphen REACTIVE protein. Okay, now we're going to go ahead and look at urinalysis. Urinalysis is literally an examination of the urine. And one thing I want to caution you about is spelling. The spelling of urinalysis is not what you'd think it would be. The spelling is urinalysis, urinalysis. Now, what it means is urine analysis. We're analyzing the urine. It's real tempting to misspell that by putting extra letters in there to spell analysis. It is not urinalysis. Do not put the extra an in there. And there's a couple of things that are checked with regard to urinalysis. The first thing is pH, small p, capital H. pH is a measure of acidity or basicity. It's how acid or how basic the urine is. Then another thing to be checked is specific gravity. SPECIFIC, gravity, GRAVITY. Specific gravity is the amount of materials that are dissolved in the urine. Now, when they're checking the urine, they can look for various compounds or conditions of the urine. And these can be signs of different types of diseases. And I've rearranged these for you and kind of broken them down so they'll be a little easier to remember. First of all, we have signs of diabetes. And you should all remember what diabetes is. There's 3 things that could be present in the urine that would be indicators of diabetes. First of all, acetone, ACETONE. Then we have the condition glycosuria, GLYCOSURIA. What would that mean? Well, I hope you remember that would be sugar or elevated glucose in the urine. That's pretty obvious. If you're spilling out sugar in the urine, that's a sign of diabetes. The body's blood sugar is too high. Then there's also ketonuria, KETONURIA. Again, we have that suffix urea, meaning urine or urine condition. Ketonuria would be a high level of ketone, KETONE. Again, if there's elevated levels of ketones in the urine, that again is an indicator of diabetes. Then we have some indicators for kidney disease. Again, some of these we encountered before in the chapter on the urinary system. The first one is proteinuria, PROTEINURIA. What would proteinuria mean? Well, that would be elevated levels of protein in the urine. If there's too much protein in the urine, that's a sign that the kidneys are not functioning properly. Then we have albuminuria, ALBUMINURIA. That would be elevated levels of albumin or albumin. And then we have creatinuria, CREATINURIA. That would be elevated levels of creatinine. And finally, hematuria, HEMATURIA. What would hematuria mean? Well, that would be blood in the urine. And then finally, we have an indicator for hyperparathyroidism. And do you remember what the parathyroid hormone does? Well, the parathyroid hormone regulates calcium, right? It tells the bones and teeth to give up their calcium into the bloodstream, into the body. So if there's too much calcium floating through the body, what would logically happen to the urine? Well, there'd be excessive calcium, right? And what would be the term for excessive calcium in the urine? I hope you got calciuria, Calciuria. If we have calciuria, that's a sign of hyperparathyroidism. Okay, now we're going to go back and do a practice with the laboratory procedures. What is the term for the specialist in obtaining blood samples for analysis? That's a phlebotomist. Phlebotomist. What measurement indicates how much material is suspended in the urine? That's specific gravity. SPECIFIC, gravity, GRAVITY. What is the term for excessive protein in the urine? That's proteinuria. Proteinuria. The presence of acetone in the urine is an indicator of what? That would be diabetes. Creatinuria is an indicator of what? Creatinuria is an indicator of kidney disease. Which blood test is an indicator of acute inflammation, which suggests a recent heart attack or the presence of coronary artery disease? That's the C-reactive protein, capital C hyphen REACTIVE protein. Which blood test can indicate either anemia or polycythemia? That's the hematocrit, HEMATOCRIT. A high serum bilirubin level indicates what condition? Liver disease. What urine condition is an indicator of hyperparathyroidism? Calciuria, CALCIURIA. And finally, which test identifies how many erythrocytes, leukocytes, and platelets are present in the blood? That's the complete blood count, abbreviated CBC. Okay, well that covers the basic assessment techniques and the laboratory procedures. In the next episode, we'll look at imaging techniques. This ends this episode of the Medical Terminology Podcast.